So I'm just going to start off with the first question, just kind of a background question. Can you give some background into the Affordable Care Act and why these subsidies were put into place back in 2021? Again, just kind of a little explainer there.
Yeah, so the Affordable Care Act was established a little over 10 years ago to help make coverage more accessible and more affordable for folks. And back when COVID was going on and the American Rescue Plan Act was passed, passed enhanced premium tax credits, excuse me, which extended financial assistance to more people and also increased the amount of financial assistance available to again make coverage even more affordable through, like I said, through the COVID-19 pandemic.
Yeah. Um, how would you say, again, I know you're talking about, again, the COVID-19 pandemic. That's why these subsidies were put into place. But obviously, right now, there's big talk in Congress when it comes to specifically these subsidies. And can you just kind of go into a little further detail as to, who these subsidies, helped, how they helped them, and who was seen to be, using these subsidies? Was it, specific groups when it came to, again, income? Was it for everyone, again, because of the COVID-19 pandemic? Just a little explainer in that.
Yeah, so premium tax credits have been available through the Care Act since it went into effect in 2014. The enhanced premium tax credits are what were started under the in 2021. And what we have seen consistently since 2021 is that about 80% of folks enrolled in the marketplace here in Oregon are receiving financial assistance. And it's a pretty substantial amount of financial assistance. We're finding that folks are getting about $531 a month on average in premium tax credit help. So it's a substantial amount of money going out each and every month to help people pay for their monthly premium.
And obviously, again, with the talks in Congress, those premiums are, if, these subsidies were to go away, premiums could go up. Can you talk a little bit about how these premiums increasing could affect users? And specifically, I've seen from other outlets, and I'm just trying to get, a full understanding of exactly how much those premiums are going to go up percentage wise, if it depends on the person and their specific plan. Just a little background into, again, those effects and what that could do for users.
Yeah, so basically, when the enhanced premium tax credits went into effect, what it did is it reduced the amount that the government basically said that folks were expected to pay towards their premium. And that amount is really dependent on how much your income is anticipated to be for the plan year. So it does vary from person to person or household to household, depending on your income. What we're finding though is that the average loss for premium tax credits for folks in Oregon will be somewhere around $960 per month. Um, or and like I said, it really just depends on individuals. Like if we're looking at a single father who's enrolled in Springfield, he might pay somewhere around $2,000 more per year. But if we're looking at an older couple, somewhere around 60 to 64 living in Eastern Oregon, they're going to pay somewhere upwards of $25,000 or more per year. And that's all really dependent on, again, income, where you live, and just how premiums are calculated. Um, it really is variable.
What could happen? Again, Congress is talking about making this vote in December, pretty close to when those subsidies would um, be set to expire. When it comes to, say, the vote does vote in favor to, keep these subsidies, to extend them longer, would you, that again, I mean, obviously it sounds like it would help those people when it comes to, again, being able to save their money, again, still continue to have affordable health care. What would that look like that outcome look like for people in Oregon?
Yeah, so right now we're actually in the middle of open enrollment, started November 1st and ends on January 15th. And so if Congress does decide to extend, hopefully in December, that would be nice because we would still be in the middle of open enrollment. Then folks would still have an opportunity to log into healthcare.gov to either enroll in health coverage for the new year or even to consider changing to a different plan. Right now, what we're finding is that folks are really grappling with the options of, can I afford to keep my health coverage, or do I need to change down to a lower tiered plan where they're going to pay less per month but have more on their out of pocket costs? And so folks are really having to weigh, what their health needs are, if they've got prescriptions or other services that they need throughout the year, compared to the differences in their premium.
That kind of answers my next question when it comes to, what advice are you guys, giving to those, again, the people that are trying to, again, figure out what to do. But again, like specifically kind of going back to that, um, when it comes to those plans, what would OHA, if someone coming in, saying, I'm struggling, I don't know what to do, what would be the main advice right now to those users out there that are scared or either just don't know what's going on, haven't even checked their premiums yet to see if this is something that might affect them? They're thinking it doesn't, what is that advice you would give them?
Yeah, so the first thing that I want to say is, I definitely want to acknowledge that this is definitely an uncertain time. It's definitely a little bit scary, especially when considering kind of the national narrative going on out there. The good news is that here in Oregon, plan premiums haven't raised as much as they have in other areas of the country. So I do encourage folks to try to stay local when they're watching their news to get a better idea of what's going on here in Oregon. But I also really recommend, my number one piece of advice would be to meet with an expert. A lot of folks don't realize that we work with a whole network of insurance agents and assisters who are able to provide free assistance. And those folks are really well versed in the plans that are available, the financial assistance, the changes, and also just the networks and services that are available in the area. And so they can really help you go through the different options, look at your health needs, and figure out what your best option is, depending on your specific situation, because it is so highly individualized. It's definitely not a one size fits all sort of service.
And you mentioned Oregon isn't being, there's a difference that you guys can see specifically within the state. Why specifically is there that difference here in Oregon?
Yeah, so here I can't, I do have to be forthright in saying that I can't speak too much about the premium changes because those are all done through our sister agency, the Division of Financial Regulation over at DFR or at DCBS. But what I can say is that Oregon has a reinsurance program, which has been able to help really keep insurance rates steady. We've also had a pretty steady enrollment, which is really given our insurance companies a lot of confidence and ability to maintain health rates pretty stable. So we have had a little, a modest increase in insurance premiums, which is typical from one year to the next. But it's definitely not as high as some states are reporting.
Well, I think those are all of the questions that I have. If there's anything specifically you want to add on those subsidies, again, what people should be doing during the specific time and just what your guys' understanding is of it all.
Yeah, the last thing that I just would add that I didn't mention before is for folks who are still considering and kind of grappling with their options, we have a really easy to use window shopping tool that's available on our website on OregonHealthcare.gov. And you can put in just a few pieces of information, nothing, too specific to you, but it will tell you what you might be looking at as far as coverage options or savings available, so that you can really weigh what options are available to you. And like I said, we've got all of those experts that are available to help. So don't hesitate, reach out, whether it's give us a call or reach out to an expert. You can find someone on our website as well.